Hi there, my name is Quinn Gordon and I'm here today to share with you more on my golden pitch idea. For the last year or so, I've been working on developing a solution to some problems I've seen facing our elder care community. In my time working as a geriatric health administrator, I've seen firsthand how our community is treated. I've seen too many good families suffer from burnout and properly organized businesses fail those most in need and watch as corporate greed force multiple people into horrifically abusive care. I remember the most difficult phone call that I've ever had to take. It was an elderly woman in tears looking for a care provider that would help her and her special needs adult. All of the in-home care providers she had contacted would not accept her insurance, and unfortunately, my company was also one that would refuse service. She could not afford the out-of-pocket care and expressed to me how distressing this entire ordeal had been. She was left at the hands of the state aid that she was provided, and unfortunately, this aid was not sufficient. Her and her daughter suffered horrific abuse. Her daughter was abandoned at a lake, beaten and abused, had cigarettes put out on her arm. And at a one-year checkup, they discovered that one of the caregivers that cycled through had been raping, molesting, and sexually abusing this girl in a multitude of ways. The only way that they could catch this, though, was through finding the STD she was left with. Unfortunately, this issue spread far and wide and has only been worsened by the pandemic. The World Health Organization reports that 67% of elder care providers admit to having committed elder abuse in the past year. This means that over 50% of people caring for your mother, your father, your aunt, your uncle, your grandfather have openly admitted to abusing people in the past. But surely this gets reported, right? Unfortunately not. According to a study done by the New York State Office of Family Services, only 4% of cases are even reported. This means that 96% of people being abused are being abused without even the chance to get the help they need. And that is why I've been working on an improved plan to help our most vulnerable population. According to Forbes, there are over 18 million elder adults that would benefit from daily aid. If we just look at Hattiesburg alone, that's 3,000 older adults that could benefit from these services. Valley Home Living Solutions would be structured in a way that allows us to take multiple insurances by having a licensed physician on staff. That way, in addition to working with VA benefits and private pay, we could also accept Medicare, Medicaid, Humana, and other various health insurances. This would allow for more people to be able to afford the in-home care they need and not be left at the mercy of the state. Valley Home Living Solutions has the potential to reach these 18 million adults, as aforementioned. Our 5-year plan is structured to begin with services in the Hattiesburg and Pine Belt region and focus on those 3,000 adults that are right here at our back doors. Then we plan to spread to the southern half of the state, begin an office in Mobile, and by year 3, expand to the southeastern region. Following that, we intend to grow to the eastern region as a whole by year 4 and potentially have West Coast offices by year 5. In addition to the expansion, we have the advantage of an ever-growing elder population. As years progress, our potential pool for clients will only increase. With more and more people facing the threat of abuse, Valley Home Living Solutions will be there for you and your family. Thank you so much for your time and have a wonderful rest of your evening.